Friends, let me ask you a question that might make you uncomfortable. When was the last time you walked out of a doctor's appointment feeling truly heard, respected, and confident in your care? If you're like most people our age, you're probably struggling to remember, and that's not an accident. My name is Frank, and at 81 years old, I've spent the last 50 years working in healthcare, first as a nurse, then as a patient advocate, and for the past 2 decades as a health advisor specializing in helping older adults navigate a medical system that, frankly, doesn't always have our best interests at heart. What I'm about to share with you today might anger you, and it should. But more importantly, it's going to arm you with the knowledge and strategies you need to get the quality healthcare you deserve, regardless of the number on your driver's license. You see, 3 years ago, I had an experience that opened my eyes to just how differently the medical establishment treats us once we cross certain age thresholds. I was 78 at the time, dealing with what I thought was a minor heart rhythm irregularity. Nothing dramatic, just some occasional palpitations that concerned me enough to see my longtime cardiologist. I walked into that appointment as Frank, the healthcare professional, someone who had worked alongside doctors for decades, someone who understood medical terminology and had always been treated as an equal by my medical colleagues. But something was different this time. The doctor, a man 20 years younger than me who I had known professionally for over a decade, looked at my chart, glanced at my age, and I could literally see his entire demeanor shift. "Well, Frank," he said with a patronizing smile I had never seen from him before, "at your age, these little irregularities are pretty normal. We don't want to put you through a lot of complicated testing. Let's just increase your medication and see how you feel." Now, if a 40-year-old had walked in with the exact same symptoms, he would have ordered an EKG, possibly a stress test, maybe even a cardiac catheterization. But because I was 78, suddenly my symptoms were just normal aging. That moment was my wake-up call. If this was happening to me, someone with 5 decades of healthcare experience, someone who knew the system inside and out, what was happening to regular folks who didn't have my background? Over the next 3 years, I made it my mission to understand exactly how ageism operates in our healthcare system. I interviewed hundreds of patients, dozens of healthcare workers, and reviewed countless studies. What I discovered was both shocking and systematic. 5 ugly truths about how doctors really see us once we hit certain ages. And more importantly, 5 strategies we can use to fight back and get the care we deserve. The first ugly truth: you're labeled expensive and complicated the moment they see your age. Let me tell you about my client Dorothy, a sharp 74-year-old tired accountant who came to me in frustration after a series of medical appointments that left her feeling like she was being processed through an assembly line. "Frank," she told me, "I swear the minute these doctors see my age on the chart, their whole attitude changes. It's like they're thinking, oh great, another complicated old lady who's going to take forever and cost a fortune." Dorothy's instincts were absolutely correct. There's actually research that proves this bias exists. A study published in the Journal of the American Geriatric Society found that medical students and residents consistently rate older patients as more difficult, time-consuming, and resource-intensive even before meeting them, based solely on their age in the medical chart. Here's what happens in practice. The doctor walks in, already assuming you're going to need multiple tests, complex medication management, and lengthy explanations. This assumption creates a self-fulfilling prophecy where they provide rushed, superficial care specifically to avoid the time and complexity they're convinced you'll require. I saw this firsthand when I accompanied Dorothy to her next appointment. The doctor spent exactly 7 minutes with her, barely looked up from his laptop, and prescribed a generic treatment without asking detailed questions about her symptoms. When Dorothy tried to explain the specifics of her condition, he actually interrupted her to say, "Let's keep this simple." The solution to this first ugly truth is what I call the prepared patient strategy. You need to walk into every medical appointment armed with specific goals, organized information, and a clear time framework that proves you're efficient and informed, not complicated and time-consuming. Here's exactly what you do. Before every appointment, write down your 3 most important health goals. Not a laundry list of complaints, but 3 specific, measurable objectives. For example, I want to understand why my energy drops every afternoon. Or I need a plan to reduce my knee pain so I can continue my daily walks. Create what I call a medical summary sheet, 1 page that lists your current medications, recent test results, and any changes in your health since your last visit. This shows the doctor immediately that you're organized and efficient, not scattered and time-consuming. Finally, and this is crucial, book double appointments when dealing with complex issues. Call the scheduler and say, "I have several health concerns I need to discuss thoroughly. I'd like to schedule a longer appointment so we can address everything properly without rushing." Most doctors' offices will accommodate this, and it prevents you from being rushed through important discussions. Dorothy implemented this strategy, and the difference was remarkable. At her next appointment, the same doctor who had been dismissive and rushed spent 25 minutes with her, ordered appropriate tests, and actually complimented her on being such a well-prepared patient. The second ugly truth: your symptoms get dismissed as normal aging. This might be the most dangerous form of medical ageism, and it's something I call diagnostic dismissal. It's when real medical conditions get brushed aside with phrases like, "That's just part of getting older," or "What do you expect at your age?" I experienced this personally just 2 years ago when I started having severe joint pain in my hand. The first doctor I saw, a young internist who barely looked at my hands, told me it was normal arthritis for someone your age and suggested I learn to live with it. Something about his dismissive attitude bothered me, so I insisted on seeing a rheumatologist. Turns out I had a serious autoimmune condition that required immediate treatment. If I had accepted that first doctor's normal aging diagnosis, I could have suffered permanent joint damage. This diagnostic dismissal is incredibly common. A study in the American Journal of Medicine found that serious conditions like heart disease, cancer, and autoimmune disorders are consistently underdiagnosed in patients over 70, primarily because symptoms are attributed to normal aging rather than investigated as potential disease processes. My client Robert, an 80-year-old former construction worker, experienced this when he started having balance problems and memory issues. 3 different doctors told him it was normal cognitive decline. Robert's daughter finally insisted he see a neurologist who discovered he had a treatable condition called normal pressure hydrocephalus. After a simple procedure, Robert's balance and memory improved dramatically. The strategy to combat diagnostic dismissal is what I call evidence-based advocacy. Instead of accepting vague explanations about aging, you demand specific, measurable criteria for any diagnosis. Here's your script. Doctor, can you explain the specific medical criteria you're using to determine this is normal aging rather than a treatable condition? What tests would you order for a 40-year-old with these same symptoms? This question forces them to justify their diagnostic approach and often reveals age-based bias. Keep a detailed symptom diary with dates, times, and specific descriptions. Instead of saying, "I'm more tired lately," document, "My energy drops significantly every day at 2 p.m. and I need to nap," which is a change from 6 months ago. Specific, time-based changes are much harder to dismiss as normal aging. Always ask this crucial question. If these symptoms were happening to your 40-year-old child, what would be your next step? This question cuts through age bias and forces the doctor to consider your symptoms without the filter of ageism. Bring a family member or friend to important appointments. Research shows that doctors take symptoms more seriously when there's a witness present, and younger advocates often receive more respectful treatment than older patients advocating for themselves. The third ugly truth: they assume you're cognitively impaired. This assumption might be the most insulting and damaging of all the biases we face. Many healthcare providers unconsciously assume that anyone over 70 has some degree of cognitive impairment, which leads them to oversimplify treatments, withhold information about advanced therapies, and exclude us from decision-making about our own care. I witnessed this bias in its most extreme form when I accompanied my client Helen, a 76-year-old retired college professor with a PhD in chemistry, to an oncology appointment. The doctor literally turned away from Helen and directed all his comments to her daughter, explaining her cancer treatment options as if Helen wasn't capable of understanding medical information. Helen stopped him mid-sentence and said, "Doctor, I have a doctorate in chemistry and spent 40 years teaching biochemistry at the university level. I'm perfectly capable of understanding my treatment options." The doctor's embarrassment was obvious, but the damage to Helen's confidence and trust had already been done. This cognitive bias has serious consequences beyond hurt feelings. When doctors assume we can't handle complex information, they often prescribe simpler, less effective treatments. They exclude us from clinical trials for new therapies. They fail to explain important risks and benefits because they think we won't understand. Research from Harvard Medical School shows that patients over 70 are significantly less likely to be offered advanced surgical procedures, cutting-edge medications, or participation in clinical trials. Not because they're not good candidates, but because doctors assume they can't handle the complexity. The strategy to combat this assumption is what I call intellectual assertiveness. You need to immediately establish your cognitive competence and demand to be treated as an intelligent adult, capable of making informed decisions about your own health care. Start every new medical relationship by briefly mentioning your professional background, education, or areas of expertise. You don't need to be boastful, just matter of fact. "I'm a retired engineer," or "I taught high school for 30 years," or "I ran my own business for 2 decades. This immediately signals that you're cognitively intact and capable of complex thinking. When discussing treatment options, ask detailed questions that demonstrate your understanding. What's the mechanism of action for this medication? Or what are the long-term outcomes data for this procedure? Or how does this treatment compare to the newer therapies I've been reading about? Don't hesitate to mention that you've done your own research. Say things like, "I've been reading about this condition in medical journals," or "I saw a recent study about this treatment approach." This shows you're engaged and informed. If you use technology, make sure the doctor knows it. Pull out your smartphone to check your medication list. Mention that you track your symptoms on an app, or reference health information you found online. This counters the stereotype of technologically challenged seniors. Most importantly, if a doctor starts oversimplifying or talking down to you, call it out immediately. Say, "Doctor, I'd appreciate if you could give me the same detailed explanation you'd give any educated adult. I'm capable of understanding complex medical information." The fourth ugly truth: medications are used to control your behavior, not treat your conditions. This is perhaps the most insidious form of medical ageism, and it's something that happens far more often than most people realize. Instead of prescribing medications to treat actual medical conditions, some healthcare providers use drugs as a way to make older patients more manageable, less questioning, less demanding, less troublesome. I discovered this ugly truth through my client Margaret, an 81-year-old widow who came to me because she was concerned about the number of medications she was taking. Margaret had been prescribed sleep aids, anti-anxiety medications, and antidepressants by different doctors. But when I reviewed her medical records, I couldn't find clear diagnoses that justified these prescriptions. "Frank," she told me, "I don't feel depressed, I just feel frustrated how doctors treat me. And I'm not anxious, I just want answers about my health problems." But every time I ask questions or advocate for myself, they suggest another medication. Margaret's situation is what researchers call chemical restraint, using medications not to treat legitimate medical conditions, but to modify behavior that healthcare providers find inconvenient. Instead of addressing the root causes of a patient's concerns, they prescribe drugs to make the patient quieter, more compliant, less likely to ask difficult questions. This practice is particularly dangerous for older adults because we're more susceptible to medication side effects, drug interactions, and what's called prescribing cascades, where side effects from one medication are treated with additional medications, creating a downward spiral of chemical dependency. I saw this cascade effect with my client Robert, who was prescribed a sleep aid for insomnia, then an anti-anxiety medication for the grogginess caused by the sleep aid, then a blood pressure medication for the elevated pressure caused by the anxiety medication. Within 6 months, he went from taking 2 medications to taking 7, and his cognitive function had declined dramatically. The most tragic part is that Robert's original insomnia was caused by untreated sleep apnea, a completely treatable condition that none of his doctors had investigated because they were too focused on managing his symptoms with medications. The strategy to combat medication misuse is what I call therapeutic transparency. You need to demand clear, specific justifications for every medication prescribed, along with measurable goals and regular evaluations of effectiveness. Here's your medication advocacy script. Doctor, can you tell me exactly which diagnosed medical condition this medication is treating? What specific symptoms or measurements will we use to determine if it's working? How will we know when it's time to stop this medication? For any psychiatric medications, antidepressants, anti-anxiety drugs, sleep aids, ask this crucial question. Are you prescribing this medication to treat a diagnosed psychiatric condition or to manage my behavior during medical appointments? This question forces honesty about the real reason for the prescription. Keep a medication diary that tracks not just your symptoms, but your cognitive function, energy levels, and ability to think clearly. Many older adults don't realize that their senior moments or increased confusion are actually side effects of unnecessary medications. Insist on regular medication reviews with a pharmacist or geriatrician who specializes in older adult medication management. Say, I want to schedule an appointment specifically to review all my medications and determine which ones I actually need versus which ones might be causing more harm than good. Never be afraid to ask, what would happen if we tried reducing or eliminating this medication? Many older adults are surprised to discover they feel much better with fewer medications, not more. The fifth ugly truth: your life is valued less because of economic calculations. This final ugly truth is the hardest to accept, but it's crucial that we understand it so we can fight against it. In our healthcare system, treatment decisions are increasingly influenced by economic calculations about quality-adjusted life years and cost-effectiveness, which essentially means that because we're older, our lives are considered less valuable from an economic standpoint. I discovered this bias when my client Thomas, a 79-year-old retired teacher, was denied a hip replacement surgery that would have dramatically improved his quality of life. The orthopedic surgeon told him, "At your age, we prefer more conservative treatment approaches." When Thomas's son, a doctor himself, called to question this decision,
the surgeon admitted that the real issue wasn't Thomas's age or health status, but concerns about the cost-benefit ratio of expensive surgery for someone with limited life expectancy. Thomas ended up getting the surgery from a different orthopedic surgeon and had an excellent outcome. At 82, he's still playing tennis twice a week and travels regularly with his wife. That first surgeon's economic calculation would have condemned Thomas to years of unnecessary pain
and limited mobility. This economic bias shows up in multiple ways. Older patients are less likely to be offered expensive diagnostic tests, cutting-edge treatments, or referrals to specialists. We're more likely to be offered palliative or comfort care approaches, even when curative treatments are available and appropriate. Research from the New England Journal of Medicine shows that patients over 75 are significantly less likely to receive aggressive treatment for heart attacks, strokes, and cancer, not because they're not good candidates for treatment, but because of unconscious bias about the value of treating older patients. The strategy to combat economic discrimination is what I call value assertion. You need to actively challenge any treatment decisions that seem to be based on your age rather than your medical condition and personal preferences. Here's your value assertion script. Doctor, would you recommend this same approach if I were 40 years old with identical health status? I'd like to understand if age is a factor in your treatment recommendation, and if so, I'd like a second opinion from a specialist. Always ask about all available treatment options, not just the ones the doctor initially suggests. Say, I'd like to know about all the treatment approaches available for my condition, including the most advanced options, regardless of cost or complexity. Research treatment options independently and come prepared with questions about specific therapies. If you've read about a promising new treatment, ask specifically why you're not a candidate for it. Make them justify exclusions based on medical criteria, not age assumptions. Consider seeking care from geriatric specialists who are trained to provide age-appropriate, not age-discriminatory medical care. Geriatricians understand the difference between chronological age and biological age, and they're more likely to advocate for appropriate treatments regardless of your birth year. Document any instances where you feel age discrimination has influenced your care. If a doctor says something like, "at your age," or "given your life expectancy," write it down, including the date and context. This documentation can be valuable if you need to advocate for different care or file a complaint. Fighting back, your action plan for age discrimination-free healthcare. Now that you understand these 5 ugly truths, let me give you a comprehensive action plan for getting the respectful, high-quality healthcare you deserve, regardless of your age. First, choose your healthcare providers carefully. Look for doctors who have training in geriatric medicine, who have positive online reviews from older patients, and who demonstrate respect for older adults in their communication style. Don't be afraid to interview potential doctors before committing to their care. Second, always bring an advocate to important medical appointments. This can be an adult child, a friend, or even a professional patient advocate. Research consistently shows that doctors behave more professionally and provide more thorough care when there's a witness present. Third, prepare thoroughly for every medical appointment. Bring your medical summary, your list of specific questions, and any research you've done about your condition. Walk in looking like an informed, organized patient who expects professional treatment. Fourth, don't accept vague explanations or dismissive attitudes. If a doctor says something is normal for your age, demand specific medical criteria. If they seem rushed or disrespectful, speak up immediately. You have the right to professional, courteous health care regardless of your age. Fifth, seek second opinions for any major treatment decisions, especially if the recommended approach seems overly conservative or if you feel your age influenced the recommendation. Many insurance plans cover second opinions, and they're invaluable for ensuring you're getting appropriate care. Finally, know your rights and don't be afraid to escalate complaints when necessary. If you experience clear age discrimination, document it and report it to the medical facility's patient advocate, your state medical board, or your insurance company. Age discrimination in healthcare is not only wrong, it's often illegal. The power of advocacy. Let me close with this thought. Every time you advocate for yourself, you're not just improving your own healthcare, you're making it easier for the next older adult who walks into that doctor's office. When we demand respectful professional treatment, we force healthcare providers to examine their own biases and treat all older patients better. My client Helen, the chemistry professor I mentioned earlier, put it perfectly after she successfully advocated for the cancer treatment she wanted. "Frank, I realize that staying quiet about age discrimination doesn't protect me from it. It just enables it. Speaking up was scary, but it was the only way to get the care I deserved. You deserve the same high-quality, respectful health care that younger patients receive. You deserve to have your symptoms taken seriously, your intelligence respected, and your life valued. Don't accept anything less." These 5 ugly truths about medical ageism are real. They're pervasive and they're dangerous, but they're not insurmountable. When you understand how the system works against us, you can develop strategies to work around it and demand the care you deserve. Remember, you're not just a patient. You're a healthcare consumer with rights, choices, and the power to demand quality service. Use that power. Your health, your independence, and your quality of life depend on it. Thank you for listening today. And remember, every time you advocate for yourself in a medical setting, you're fighting not just for your own health, but for the dignity and rights of all older adults. That's a fight worth having, and it's a fight we can win.